Hello, everyone, and welcome back to the podcast. I am your host, Dr. Judy, and today's guest is none other than Dr. Micah Yu. Welcome, Dr. Micah Yu, to the show.
Thank you, Dr. Judy, for having me. It's an honor to be on your podcast.
Yes, I've known you and your wife for some years now. You guys have become great friends of mine. And so I'm so excited to have you on today to share your insights with my audience. And so, first, let me read your bio. Y'all, he is knowledgeable, stacked, and experienced. So, Dr. Micah Yu is an integrative rheumatologist who incorporates complementary medicine with traditional rheumatology. He is triple board certified in rheumatology, internal medicine, and lifestyle medicine. He obtained his doctoral degree from Chicago Medical School and holds a master's in healthcare administration and biomedical sciences. He completed his internal medicine and rheumatology fellowship at Loma Linda University in Southern California. He is also a graduate of the Andrew Weil Integrative Medicine Fellowship at the University of Arizona. In addition, he is certified in functional medicine through the Institute of Functional Medicine. Dr. Yu has a very unique perspective on autoimmune disease and arthritis, as he is both a patient with arthritis and he's a physician. Dr. Yu was diagnosed with gout at the age of 17, and later he was diagnosed with spondyloarthritis as well. So he is able to understand his patient's medical problems from a patient perspective, which is very valuable. And the foundation of his practice is to combine allopathic medicine with complementary medicine. So thank you so much for joining us and welcome again. I'm so excited to have you on because, as you know, my professional journey has led me towards complementary, integrative, and functional as well. And there's definitely a need in the space to merge all of these modalities together. I find it empowering for patients to give them information of what they can do to prevent conditions, to put them into remission, and the role that diet, stress, mind, body, spirit, exercise all play in chronic disease is very important. So thank you so much for your time today.
Yeah, thank you so much for having Judy, having me on, Judy. I'm excited to share my knowledge about autoimmune and inflammation today.
Yes, it's not often that you meet a physician that also has the patient experience. And I find that that gives you deeper insights than you would not have otherwise gleaned. It makes you sometimes more empathetic, like you can understand the patient in a deeper way. So, can you share what it was like being diagnosed with gout and spondyloarthritis as a child?
Yeah, it was, quite difficult. You don't expect to have joint pain when you're in high school, but I sure did after um, going on a high protein diet. Unfortunately, it gave me gout. And some people they can go on a high protein diet, they don't get gout, but my genetics didn't play out that way. So I ended up getting gout. And after I got diagnosed, I still have pain, but it waxed and waned. But over time, that pain really transformed into another beast with joint pain that you don't expect from gout. So I struggled many years in medical school and after college with debilitating pain in multiple joints from the jaws all the way down to the feet with no explanation. And eventually, I did get diagnosed with spondyloarthritis during residency by the rheumatologist there, and um, it was diagnosed because they found inflammation on an ultrasound, and also when they took fluid out of my joint, it shows pseudogout. So I actually have three diagnoses, but two of which I just mainly speak about. And I was offered medications for my spondyloarthritis, which I respectfully declined. And luckily, I found food as medicine with
Mm.
plant-based nutrition. I went on a whole food plant-based diet, and then I got fixed within a couple months. Uh, so it's been quite an amazing journey. And because of my own battle with rheumatology diseases as a patient, it really led me down the rabbit hole of integrative medicine and functional medicine to figure out how else I can help my patients naturally as well.
Oh, wow, that's an interesting journey. So you were diagnosed in medical school, you said?
I was diagnosed in residency, actually,
Or
was from
residency. Okay.
I was looking for a diagnosis in medical school by seeing other rheumatologists, but no one could figure me out yet.
Wow. That must have been difficult, especially with the starting in high school. Because most
Yeah,
people are trying to be active, I don't know, in sports or different things.
yeah. I mean, it was tough. You think about whether you can walk in 10 years at such a young age because the pain will be so debilitating. You have to limp to work, to school. So I'm very fortunate to have improved significantly with the therapies I've gone through.
Yeah. So you said that you declined the medication and you found food as medicine. So tell us about that journey and what dietary changes did you make or what did you discover about food?
Yeah, I mean, back in medical school and college, my diet was very poor. I would eat frozen food like lean pockets, what people would call ultra processed food now. But in after medical school, I thought I was eating a relatively healthy diet. I mean, for a standard American diet, compared to it, it was not bad. But still I have fast food and stuff. Still I have frozen food every now and then. So I changed up my diet a lot to a whole food plant-based diet, which is pretty much a very clean vegan diet, which is what I did for a couple of years, and it did help me quite a bit. I was pain-free. I would be shocked. I mean, the first 2 months in, I would be counting the weeks. I'll be like, "There's no pain. There's no pain." I was just waiting for a flare to happen because a flare would happen every couple of weeks to a month, but it never came on. And what convinced me that this was really working was when one of my inflammatory markers, C-reactive protein, actually went negative after 5, 10 years of being positive. So that was a shocker, and that's what really got me to be really passionate about this field.
Wow. So your CRP went from being elevated to normal, negative,
Correct.
or zero. Wow. Were your doctors surprised?
I think they were pleasantly surprised because doctors don't talk about the stuff, they don't learn about the stuff. So when I made myself an experiment and it worked, they were pretty happy about it. So the doctors, my rheumatologists were also my bosses because I was in fellowship at the time.
Oh,
Trying to
okay,
remember.
right. Oh, that must have been interesting. So I discovered lifestyle medicine and the power of food, like maybe when I went to the first conference, 2016. But it's
Mm,
always been a part of like who I am. I've always been big on nutrition, and autoimmune conditions is the one thing that initially I did not know could be put into remission. Like I knew type 2 diabetes, hypertension,
mhm.
obesity, but the autoimmune piece initially I was not aware of. And then I started to read more people and meet more people like you and read about people who were able to put it into remission with diet. So I want people to remember that even autoimmune conditions can be put into remission with dietary changes.
Yeah, it's very surprising. I was on the same boat as you, as a med student, and even as a resident, as a patient struggling with these diseases. I never heard of people putting this to remission or autoimmune disease with food as medicine. You don't learn about this stuff. Um, this is something that maybe our naturopathic colleagues and alternative medicine colleagues have known for many, many years. And of course, ancient medicine, many, many years ago, thousands of years ago, they were using food as medicine. But unfortunately, in Western medicine and allopathic medicine, we've sort of lost that art and that knowledge, and slowly we're regaining it now through scientific evidence. So I think it's time that the world knows that you can heal autoimmunity through other means. Not everyone's going to get fixed by food as medicine, but certainly there is a subset of patients out there that it's quite possible.
Yeah. Yeah. And do you find that if you eat certain foods that you will get a flare up, like if you eat inflammatory foods?
Yeah, I can get flares. I won't say I will. I can get flares if I eat like really fried food, ultra processed food. I don't eat too much fast food these days anymore. I don't remember when the last time I ate fast food, but if I eat really oily food, I can get flare ups too. Seed oils can flare me up. Fried food, ultra processed food like candy, chips. If I eat a couple of these, I don't flare. But if I eat like a whole bag
Mm-hmm.
or eat multiple days of these foods at like multiple parties in
Mm-hmm.
a row, I can flare. Drinking some alcohol doesn't make me flare, but if I drink a lot of alcohol, I can flare. But overall, I'm pretty much in remission. I work out. I do high intensity workouts. I do martial arts. I wake up without stiffness. I don't have swelling. And if I do get pains, it lasts for a day or two. Um, And so, yeah, I mean, those are the main foods out there. But on a day to day basis, I feel like I'm better than I was 20 years ago. I feel younger than I was in high school.
Oh, that's amazing. That's so good. And you're not on any medications for it,
No, I am not on any medications for
right?
my
Yeah.
spondyloarthritis. For my gout, sometimes I will take some meds to bring down my uric acid, but I'm not the best
Hmm.
patient, so I don't take it on a daily basis. I should be, but I don't flare with gout either. At least I don't remember the last time I flared with gout. So yeah, I'm very fortunate to be in this position.
Yeah, that's good. Now you talked about inflammatory foods, and I don't know if you feel this way, but now that you know what you know about nutrition, I feel like when I walk into the grocery store, like a lot of those foods are packaged,
Yeah,
processed foods. Like it's
exactly.
no surprise that there's so much inflammation.
Yeah, I mean, it's not natural to eat these foods, but we're all human. Even if we have a lot of knowledge, sometimes it's very tempting just to try it out if it's
Yeah.
a new product.
So what are your top inflammatory foods that people should stay away from?
I would say refined sugar is number one. So from your candies, ice creams, sodas, even diet drinks are very bad for you. It can be inflammatory. So any type of refined sugar or fake sugars, I would try to avoid, but especially refined sugars. High salt can be inflammatory as well. Like if you eat out, that's pretty high salt already. If you don't tell them to control the salt, seed oils can be very inflammatory for autoimmune conditions as well. Sometimes dairy and gluten for some patients, or actually a lot of patients, can make them flare and feel like not good. Yeah,
Okay,
those
that's good to know.
and processed meats are very bad too. So the hams, the sausages, sometimes those are very processed, and they can add to inflammation in the body. So I tell patients if you're gonna eat meat, you gotta eat very clean meat, wild caught fish, or even grass fed meat if you're gonna eat those products.
Okay, yeah, that is better. Now you mentioned about seed oils. What is your view? What does the data say about seed oils? Because I've seen different opinions, and I've seen that seed oils are bad, and I've seen seed oils are not bad. So I'm still kind of like, where are we on seed
Yeah,
oils?
I think the data is not convincing enough right now, but sometimes the data is not going to come out for a long time. There's um,
Okay.
so seeing patients as a patient myself, I see autoimmune patients all the time, and they do flare with seed oils. So I would say extra olive virgin oil is probably the best oil out there, but it has a low smoke point, and then avocado oil potentially, but some of the other oils like canola oil, sunflower oil, some of these can trigger joint pain and inflammation and flares in my patients.
Okay. Even just sauteing with it, like a little bit,
I
you've
mean, I
seen
tell patients,
sometimes.
look, you try to cook with water if you can, but if not, if you want to saute, use avocado oil. You can use a little bit of that, but try not to like use a lot of these on a day to day basis. It's not healthy for
Okay.
autoimmune
Yeah.
immunity.
Do you try and stay away, or do you recommend to stay away from all oils altogether, or you think olive oil is okay?
I think olive oil is okay, but I try to tell patients I don't tell them to stay away from everything. I just tell them to minimize it as much as possible. But I have a group of oils that I tell them try to avoid this as much as you can. But I mean, when patients eat out, they're gonna experience these oils. It's only at the home can you
Right.
control it because they're gonna put peanut oil. They're gonna put oils they're gonna be using over and over again.
That's true. Yeah, I use olive oil, and then if I'm heating, I use avocado oil because
Mhm.
I'm like you. Like to me, the data is not. I haven't seen that much strong data on seed oil either way, but I'm just like I don't need it, so I'd rather just not eat it and later on find out that I'm doing the right thing
Yeah, I mean, I see patients feel like crap eating these foods, and sometimes
after
I
it.
do
Yeah,
too. So I just try to avoid it.
yeah. And you mentioned dairy. I've noticed. Yeah, dairy can be inflammatory too. And then gluten. Can you touch on this gluten? Because some people, there's two schools of thought on gluten too, right? There are some people that say, oh, well, you don't need to avoid gluten unless you're got celiac disease.
Mhm.
But I've found that there are people who have problems from gluten, like they feel tired, inflammation goes up. So, what does the data show on gluten and
Right. So,
autoimmune?
right, with gluten, there's non celiac gluten sensitivity. So patients can have gluten problems with gluten, even if they're not celiac disease. In the autoimmune world, celiac can cause a leaky gut. We know it can increase intestinal permeability. The
Mm,
work of Dr. Fasano from Harvard does show that it increases intestinal permeability. Gluten in America is different from Europe in different ways. Maybe it's the way it's processed in the food. But gluten, I have patients who go overseas to Europe and they eat gluten and they feel fine. But when they come back, they feel really bad. So I tell patients to avoid gluten as much as they can, but if they want to experiment with it, they can bring it back in their diet after they eliminate it and see how they feel. I personally don't have a problem with gluten myself, I think it's very patient dependent. But there is a big group of patients in the autoimmune community, especially rheumatology community, that do react to
mhm.
gluten.
Yeah, that's interesting. I've read and heard the same thing that the gluten in Europe is different, or the wheat in Europe is different than in America. And there's actually a brand, I think it's called Einkorn. I can't remember the name, but there's a brand that people buy of wheat flour that's apparently made overseas, and they have less of a problem with it. So I don't
Mhm.
know, maybe it's something with the processing here
Yeah,
of the
yeah, I
wheat.
know. It's the way food is made in America.
Yeah. So we talked about foods that are inflammatory. Um, Now, what about foods that are anti-inflammatory that people should try and incorporate more of in their diet if they want to reduce inflammation and reduce the risk of autoimmune conditions?
Yeah, I would say the vegetables, number one, are very anti-inflammatory. The phytonutrients and the fiber. So I encourage cruciferous vegetables with broccoli, cauliflower. It increases a pathway called the NRF2 pathway, which is an antioxidant pathway. It's anti-inflammatory, but it also can with the phytonutrients with sulforaphane. All these are very powerful, but all the other vegetables and fruits are very, very helpful as well to fight inflammation. Blueberries, blackberries, um, all the different colors of the rainbow are very helpful. However, there is
Okay.
a group of vegetables out there that can trigger some pain and inflammation in patients, even though the data doesn't back this up yet. So it's the nightshades, tomatoes, eggplants,
Mm,
peppers, bell peppers. Sometimes patients do flare with these foods. The evidence isn't strong enough for that right now, but I see in my patients I know that whole grains can be very healthy for patients. The data shows that it helps with longevity. However, in the autoimmune population, grains can sometimes trigger inflammation and flares in patients because of food sensitivities, because your gut microbiome is so dysbiosed and so out of balance. So your gut will react to different foods that are healthy. Also, beans and nuts, they can contain lectins, and sometimes patients do flare on lectins. But so for these foods, I eat these foods. I don't flare, but there are patients who will flare on them. So that's why sometimes the autoimmune protocol diet or the paleo diet is so popular because it avoids all these
mm.
different triggers and it agrees with the patient.
So it sounds like it needs to be a little bit of a customized approach, right? Like
Exactly.
not a one size fits all, not like everybody cut out gluten, everybody eat gluten, everybody cut out lactins. It's kind of
Right.
like you try it, like maybe like an elimination diet, and then kind of reassess.
Exactly. Exactly. So everyone's different. I can't eat nightshades. I eat lectins. I do fine. But some patients, they touch it, they flare.
I see. And what are the foods that have lactins? You said beans.
Yeah, beans. There's beans and lentils. I think nuts have some as well. There's some I think nightshades are a type of lectin as well.
Okay, gotcha. Yeah, that's interesting. Hmm.
Yeah, it's
So do you follow a
go ahead.
oh go ahead?
No, yeah. So that's why it's so custom tailored, and even though I see these things as a rheumatologist, sometimes the data doesn't back it up. That's why there's so much controversy in the autoimmune.
Hmm. Yeah, yeah. There's so much controversy. Oh my goodness. So, what about um, someone who has a family history of like arthritis? And well, I guess actually there's two types of arthritis. That should be the question. What are the different types of arthritis? And what I was going to ask is someone who has a family history of arthritis, how can they reduce the risk of actually developing it?
Yeah, I mean, there's probably over 30 types of arthritis out there.
I know.
Um,
I was like, that could be a long question.
yeah, so I would say there's you can break it down to inflammatory arthritis and this regular osteoarthritis. Osteoarthritis is just wear and tear. There can be like an inflammatory type of that. It's called erosive osteoarthritis, where they get holes in their on the sides of the bones and the joints due to aggressive form of it. And then there's an inflammatory type, which is more like autoimmune or inflammatory. It doesn't have the autoimmune. So gout is an inflammatory type of arthritis. So it's something immune
Mm,
mediated in a way. And a patient with a family history of arthritis, for, if it's autoimmune arthritis, for example, like RA, I mean, they have the gene predilection for it, but you can eat healthier, eat an anti-inflammatory diet to begin with, stressing less, avoiding toxins,
mm,
and doing the exercising as well, doing all these things in your lifestyle that's in your control, and maybe taking some supplements to try to prevent this. But sometimes patients, their genes are so strong that you can do all these things and they still develop the disease.
mm-hmm. Yeah, that's true too. So
Yeah.
there is a goat diet, right? Can you talk
Mhm.
about like there are certain foods that people should avoid if they have gout? What are those foods?
Yeah, so gout, we tell patients to avoid a high purine diet. So what gout is a disease, is a metabolic disease that can be exacerbated by metabolic syndrome like obesity, diabetes, but it is mainly a disease of high uric acid. Sometimes we do see patients with gout with low
Mm,
uric acid as well. So it doesn't have to be high uric acid, but that's the general consensus at this time. And we tell patients to avoid a high purine diet because purines can break down to uric acid. And so high purine foods are like red meat, shellfish,
okay.
just high protein foods. And so we tell patients just to minimize these foods as much as possible. And there's data to show that also refined sugar can raise uric acid levels as well. So we tell them to avoid that also.
Okay, so seafood, red meat, sugars.
Yeah, just like even chicken, sometimes we tell patients to avoid because it still has purines in it. So
Oh
more,
wow.
so basically
That's
eat a
good to
plant
know.
predominant diet. That's the
Plant
consensus
predominant
right now.
diet. Yeah. The plant predominant diet helps a lot of conditions too.
Right. I mean,
The
yeah.
healthy plant diet.
Yeah, exactly. I mean, there's data for diabetes, hypertension, all these different diseases out there.
Yeah. So how does come to be interested in functional lifestyle integrative? Like, do you think that your um, history of having gout and spondyloarthritis kind of influenced your career path?
Yeah, definitely. Without my disease, I don't think I would have gone down this path. But because of my disease and the fact that I was able to heal it naturally, it really got me curious and really passionate to find out what else is out there in the world that can fix my patients naturally. Um, because there's medications that can control disease, of course, and it's very useful, and there's nothing wrong with doing that. But as a patient myself, I never wanted to go on these medications, and luckily I was able to avoid it.
Yeah.
But um, and I have patients who also want to avoid these medications. So it's a passion of mine to uncover what else is out there because we have ancient medicine with acupuncture, Ayurveda,
Mm-hmm.
who have been able to help these patients in the past and still do with these diseases. So what else can I do for these patients that is more natural? We have our naturopathic medicine colleagues that have done amazing things with patients as well. So I know there's there's a battle between allopathic and naturopathic medicine, but because of my journey going down this path, I actually work very well with both sides of medicine. So I'm able to talk to naturopathic doctors and I'm able to talk to allopathic doctors.
Mm-hmm. Yeah, and that is actually rare. I saw a naturopathic doctor last year, and they said that they wish that there were more medical doctors that were kind of open to naturopathy so that they can like connect, collaborate, and talk together about the patient. So there's definitely a need for the two to be brought together instead of being in opposition. So I love that you are knowledgeable about all of these different modalities, because allopathic medicine is not the answer for everything for everybody. And
Hmm.
this is my opinion. I feel that sometimes it's focused on symptom alleviation as
Hmm.
opposed to like true healing or like getting people off of medications. It's like we put people on medicines, but there's really no training on how we can actually help people not need the medications. It's kind of like you get this medicine and then you're on it forever. But there are a lot of people that don't like taking medications for whatever reason. And if they go to the traditional doctor, most times than not, they're going to be told that they don't really have a choice, or that that medication is the answer, or that diet doesn't really matter. People have been told these things by providers.
Hmm. Yeah, it's unfortunate the way healthcare is. The healthcare system is broken in many different ways. So I think there's pros and cons to both fields, and there's no perfect
Yeah.
field of medicine. I think there's something useful for every patient out there.
Yeah, I agree. I'm a fan of using all of it. I'm like, use all the tools that we have
Yeah,
available.
whatever
So,
works.
yeah, I love all of it. So, what's the role of stress? You mentioned stress earlier a little bit. So, what is the role of chronic stress and emotions with regards to inflammation?
Yeah, so stress is can be very inflammatory. Your stress can put you in a sympathetic um, overload. So you're always in fight or flight mode. It can raise inflammation over time. You're constantly using cortisol in the body. So sometimes your receptors are not as sensitive anymore if it's chronic cortisol elevation. Um, and also, you want to stimulate the vagus nerve to bring down inflammation. So when you're chronically stressed, your vagus nerve isn't being stimulated, and that can lead to more inflammation. We know there's the inflammatory markers in the body can come from the brain, and it can have a
Hmm.
downstream effect to the adrenal glands and the rest of the organs. So if you're constantly throwing inflammatory cytokines like TNF, interleukin 6, those eventually go to the joints and it affects the immune system and the different organs, and eventually your immune system just has had it and it starts developing symptoms and antibodies. And these inflammatory cytokines, inflammatory molecules can cause oxidative stress and can cause mitochondrial damage, which can eventually lead to more inflammation because you need a mitochondria to help with inflammation. So, for those of you that don't know or understand, the mitochondria is your powerhouse of your cell. That's where energy is made, but also that's where you can help fight inflammation as well. So, when you have all this inflammation going on, it can eventually cause some disease, whether that's autoimmune disease or some other type of disease that's going on. So, we have to reset our mind and do meditation, mindfulness, guided imagery, other things, and even playing piano or doing some art, or enjoying your hobby, spending time with family. These things can bring down inflammation, bring your body back to homeostasis, and just try to avoid disease. I mean, that's the end of the day. We all want to avoid disease.
Yeah. I'm so glad to hear you say that, because I'll admit I used to be one that thought meditation was just some woo-woo stuff and this whole mind body, until I had my health situation a year ago, right? Basically, my body was kind of like stuck in fight or flight, like long COVID, chronic fatigue syndrome type of thing. And so I discovered meditation and started doing that for like hours a day, and it helped so much. Like I had a fast heart rate, like, you know, that brought that down. So meditation is like life changing. If you are
Mm-hmm.
somebody that has high blood pressure, your heart rate is up, you're stressed, like doing meditation is like, I was actually quite shocked at how much improvements were just from doing meditation. I couldn't believe it.
Yeah, yeah, it can help a lot.
Yeah. And then I did a mindfulness course too, a mindfulness based stress reduction course. That was helpful too. I'm sure you
Yeah,
learned all of that in your integrative fellowship. You probably do all of that stuff, right?
yeah. We dabble in all these different therapies. I don't do MSBR, mindful stress based reduction with my patients, but I tell them to go through like courses or do it on their own.
Yeah, yeah. What kind of meditation do you do? You have a particular one that you tend to like?
I don't do much meditation at all, unfortunately. I pray. I work out. I do martial arts. I do kung
Yeah.
fu, Shaolin kung fu. Those things help me bring me to the present moment. Um,
Oh, okay. I didn't know you did martial arts. That's cool.
yeah. So unfortunately, I would love to meditate, but my mind is I think wanders too much.
I know it's hard to stay focused when you first start doing it because we're so busy. Our society, we're always thinking about the next thing that we have to do. And we're
Exactly.
always doing.
Exactly.
But exercise is good and helpful too. And speaking of exercise, I just thought of something. There are people sometimes who have joint pain, joint problems, so they're
Mhm.
not able to exercise like how they would want to. I actually have somebody in mind I'm thinking of. What are some low impact exercises that people can do in those situations?
Yeah, I mean, there's so many things out there. You can do rowing. I just got a rowing machine. So rowing is very low impact on the lower bodies. There's Tai
A
Chi,
rowing machine? What is
rowing,
that? Is that the
like you're
thing where
rowing.
you sit down and go like
Yeah,
this?
yeah, yeah, yeah.
Oh,
It can give a great workout. I just built my home gym, so that's one of the things I bought.
oh,
And then
nice.
yeah, and then there's Tai Chi, there's Qigong. Tai Chi is actually a
Okay,
form of martial arts, but it's very slow. But you just can't see it as a martial art, but until you understand what it is. There's
okay.
yoga, there's Pilates. All these things are very low impact.
Oh, yeah, that's true. So there's options. There's also water. Isn't there like water aerobics? Doesn't that help people
Yeah, oh yeah. I mean, swimming, of course. Yeah, swimming, water aerobics is
swimming?
one too.
Yeah, or light walking.
Yeah,
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 because some people will like, oh, I can't walk, I can't work out because I have joint pain when I walk.
hmm. Yep, exactly. So all those things are
So
very
what about this idea?
mhm.
Oh, very useful.
Yeah, all those are very useful exercises for those patients that can't really walk.
Yeah, movement is so good, and that helps to reduce stress too. It helps you to sleep better. Like if you work
Mhm,
out during the day, you'll find that I find that I'm able to sleep better at night.
exactly.
Yeah. So there's a lot of conversation around inflammation being like the root of all chronic diseases. Like
Yeah.
everything is inflammation, even Alzheimer's. So
Yep.
can you explain for our audience what inflammation is and how that leads to disease?
Yeah, inflammation, it's not a bad thing. We do need inflammation from time to time, like when we're fighting viruses, bacteria, you get a
Mm.
cut, you need inflammation to work so your body can fight those things or heal. But the problem is not acute inflammation. The problem is chronic inflammation, turning on inflammation 24/7 all the time. That leads to chronic disease. And inflammation is pretty much there's in immunology, there's a group of cell called cytokines, and cytokines there's pro-inflammatory cytokines. Cytokines do a lot of different things, but there's anti-inflammatory and pro-inflammatory cytokines. And cytokines, when we get a virus or bacteria, we turn on our pro-inflammatory cytokines. Those include TNF, IL-6, IL-17, and those are deployed by our body. It's like an army. Our body sends the army out, Marines, the Navy to fight these viruses and bacteria. And when the Navy and the Marines, when they're done with the war with the virus and bacteria, you want them to come home. You don't want them to keep going on. So what happens in inflammation and chronic inflammation? The army and the navy and the marines just keep fighting and fighting, and there's no turn off signals, and that can lead to eventual inflammatory diseases like rheumatoid arthritis or lupus.
Oh, I've never heard it explained like that. So inflammation is good for fighting like acute infections and illnesses, but then it needs
Mhm.
to be turned off.
Yeah. So we have mechanisms in place in our body to turn those off, such as the T regulatory cells. Those are used to help the body know that, hey, it's time to finish up the war. We're done fighting the virus. But in autoimmune diseases, especially in rheumatic diseases, the T regulatory cells are depleted. So that's how our T regulatory cells are used for immunomodulation to help control, regulate the immune system. But those get depleted in autoimmune disease. So that's when autoimmune disease gets jacked up.
Oh, I see. Ooh, that is so interesting.
Yeah,
And
so
do you agree that most conditions are either caused by or influenced by inflammation?
I think so. Yeah, I mean, diabetes, there is inflammation in the body. Alzheimer's, and all these neurologic and rheumatic diseases, GI
Mm,
disease. There's inflammation at work. We will find out later on that a lot of these is some immunology um, part of these disease that's happening.
yeah. So it seems like it's a really good idea to limit the inflammatory foods that we're eating, increase the anti inflammatory foods, and try and do everything that we can to reduce inflammation, like on a daily basis.
Exactly. Yeah, it's so important to do all these things to limit the inflammation so you don't get chronic inflammation.
Yeah. And I guess it's easier to, well, I shouldn't say, I was going to say it could be easier in some cases to prevent something, to prevent the condition than trying to put it into remission. I think
Mhm.
sometimes people go into reactive mode. Like once they get the condition, then they want to do all these things. But what I try and get people to do is to be just as aggressive at preventing, like try and prevent that thing from happening. And sometimes there is this idea that because this condition runs in your family, then that means that you are automatically going to get it. And I find people sometimes accept disease as though it's a normal part of life. Like the bar is so low. Like we think that once we turn like 40 and 50, like your body just starts falling apart like a broken down car. And I'm
Yeah,
like, I
yeah,
don't want my body to be like that. I don't think
right.
that's the case.
Yeah, there's ways to avoid it as much as possible.
Yeah, I want to be like the people in like the blue zones who are like 80, 90, 100 and still like active, vibrant,
Exactly.
walking without a cane or walker.
That's all our goal. That's my goal too.
Yeah. And when you see people that are doing it, you like, oh, okay, this is possible for me. Like even if you have a family history, there's still things that you can do, like you share, like diet, mindfulness, meditation, exercise to at least reduce your risk of getting chronic disease or delaying it. Of course, you can't prevent everything from happening because it's just life, but a lot of things we can actually prevent or have some sort of impact on developing that condition.
Right, right, right. So yeah, we're not bound to our genes. We can use food as medicine, mind body medicine to help maybe minimize the risk factors of avoiding of getting those diseases.
Yeah. And it's encouraging for people when they hear stories like you of someone who's put into remission and you're working with patients who are putting it into remission as well. I remember the first story that I heard of someone who had multiple sclerosis and she put it into remission.
Hmm.
Um, she's actually a doctor. You probably know that person.
Yeah, I mean,
um,
there's two doctors
Dr.
out there.
Sarai Stancic.
Yeah, Dr. Stanchik and also
I think she
Terry
has a
Wall.
book or a movie. Oh,
Hmm.
yeah. Terry Walls is another one. Did she have
Yeah,
multiple sclerosis?
yeah, she has also multiple sclerosis.
Okay, they both had it. Yeah, yeah. They put it into remission. And that was one that I was like, you can put that into remission?
That's what I said.
I was like so surprised when I first heard that.
Things you don't learn about in medical school.
I know. So, actually, what is autoimmune? For people that are wondering, we've gotten this far. Actually should have asked that question. Like, what is autoimmune
Yeah,
disease?
autoimmunity is your pretty much your immune system attacking itself. You can form antibodies, some of which we probably don't have the technology to find out right now, but it's pretty much your immune system attacking itself with chronic inflammation.
Okay, so your immune system attacking itself.
Hmm.
That sounds scary.
Yeah, so that's how lupus, right, all these diseases happen.
Okay, yeah, lupus. Lupus is another one. That seems to be that's more common in people of color, right?
I
Is it
think
more common in people of color, women?
I don't have the stats on me, but I've seen, I mean, all types of races with lupus. So
Okay.
yeah, I have to look back at the data to see if it affects people of color more.
Yeah, I don't know. Have you seen lupus be able to be put into remission?
I've seen it too.
with the same dietary,
With various diets, yeah.
various
People,
diets.
plant-based diets, paleo diets. I've seen it all.
Okay, interesting. And how long does it take once someone makes the dietary change? Like, is this something where it takes like 3 months
Everyone's different. I've
or
seen people improve within a month. I've seen people take 6 months. Some people don't improve at all because maybe food isn't the main issue. It's something else.
so it sounds like it's a lot of investigation that you have to do in your clinic. You're like,
Yeah, my clinic is very custom tailored for my patients. No one patient is the same in my clinic. Their treatment plan's not the same either.
mm, that's actually a very good approach too. And I'm sure that even the way you order lab tests is probably different and customized as well. Because I know when we were talking previously, you in functional, your training and integrative, you learn about a lot of blood tests that traditional doctors don't even know about. Like there's a whole world of testing that
Yeah.
we don't know about. Like I'm an internal medicine doctor. I don't even know about some of these testing that I'm sure you know about. So I want to put that plug in there for anyone who's watching and maybe you're dealing with an autoimmune condition or a rare condition or something like that, and you just feel like you haven't been breaking through. Although internal medicine doctors are amazing, I am one. I will have to say that functional medicine, integrative medicine trained physicians have knowledge that we don't have. That's going to put it that way because I've been to all the conferences, right? And I actually was going to get certified, but I didn't go all the way. So I
Mhm.
know what they teach. And I was like, how come I didn't learn about these blood tests? I didn't know about these gut testing. I didn't know about these things. And then supplements. Like I used to think that supplements were just like nobody needs supplements, right? But then I started to learn. I was like, no, some people do need supplements.
Yep.
So
It can be very powerful if you know what you're doing.
yeah. What is your view on supplements?
I mean, I love supplements. That's what has helped me, has helped my patients. They can be the mechanisms. There's a mechanism for every single one of these that can help the body either through inflammation or other pathways. And the risk of going on supplements is very low. Unfortunately, in medicine, when you see a side effect from a supplement, you write out as an article, as a scientific article, thinking it's the worst thing in the world, but you could get side effects from medications too. So these supplements, everyone was going to react differently. Some people get side effects, just like meds. But I'm a big advocate of supplements.
Yeah, yeah, me too. And I used to be previously didn't really think that they were needed until I had to be more open minded about the situation. I take supplements now, several different ones as well. And like I say, I'm sure you've known some people benefit and some people need them. So,
Mm-hmm. Yeah, so it's
yes,
very customized.
yes, yes. Well, this has been so enlightening and encouraging for our viewers who may be dealing with an autoimmune condition or have a family history of it. So, thank you so much for sharing your knowledge and information with our audience. And I'll put the link to your website and your social media in the notes and below. But can you just share with them where they can find you?
Yeah, you can find me on my social media handle on YouTube and Instagram and TikTok and Facebook at my autoimmune MD. So that's MY Autoimmune MD. So MY stands for Micah Yu. And then you can go to myautoimmunemd.com for my personal website. And then you can go to drlifestyle.org to find me in my private practice. That's www.drlifestyle.org. I'm also a medical director of another virtual rheumatology clinic called Remission. So that's remission.com. But if you want functional and very personalized, tailored approach with integrative functional medicine, you can find me in my private practice where I see patients all over the US pretty much.
Awesome. Yes, this is going to be so helpful for so many people I know. So thank you so much for sharing your information with us. And definitely check him out, guys. You can make an appointment, visit his social media page. He shares a lot of information on there as well. So thank you so much, Dr. Yu.
Thank you so much, Dr. Judy.
All right. Bye.
Bye.